Hello and welcome to Uniform Health, where we take a uniform perspective on a healthy lifestyle. So today we're going to talk about vaccines and some of the issues that are coming about with this anti-vaccination movement, along with the way the medical community is dealing with it. So the anti-vaccination movement is taking strong positions regarding autism and its correlation with vaccines. They're also taking positions against other additives that are in the vaccine. Now, how the medical community has dealt with this is basically shaming and putting the anti-vaxxers in a position of stupidity. And I don't believe this is really what should be done. What should be done by the medical community is understand these anti-vaccination movements. And I think part of it is somewhat to do with something which is interesting. The idea that a vaccine gives you protection over an illness. Now, let's take the flu, for instance. The flu is a fairly unique form of a vaccine because the flu vaccine, because it is an estimate of what the top 3 or 4 most pertinent flu viruses of that season are supposed to be. So the CDC makes a prediction, then they cocktail up a flu cocktail, and then they'll make that and procure it and give it to everybody. That has a varying degree of success. Sometimes it can be as low as like 25%. And when you're talking about vaccines that are used specifically from a herd vaccination perspective, meaning that you vaccine the majority, or 90% of the herd, and the other 10% are basically that would have gotten sick even with the vaccine are now protected by the other, by simply for the fact that the virus couldn't contaminate the other people. So if that logic is then applied to the flu, and it's only 25% effective, I mean, that's pretty much a pretty personal choice. Now, akin to this, a lot of people will say that the flu vaccine can't make you sick. So, it's a dead virus, typically. There are some live vaccines as well, but we'll stick to the premise that the majority of them that are administered intravenously with a shot are dead viruses, and thus can't kill you or can't make you sick. Now, there's one caveat to that. Vaccines, like many other medications, come with side effects, and those side effects can be fever, headache, sore throat, nausea, many of the symptoms of the flu. Now, I'm not saying that vaccines make you get sick. What they do is give you symptoms that you're trying to prevent, and thus makes them somewhat of a fallacy. I still think you should get vaccinations, particularly when the CDC has made a strong prediction for the flu. Now, let's talk about measles and the smallpox and the whooping cough. Those are totally different because they have designed preventative measures over a long term, the CDC. This isn't some prediction. This is what they've designed to be the issue. Now, how effective it is again dependent upon herd policy or herd methodology, and they also have a much stronger effect on whoever gets it. Let's say measles, that's not something you want to get. That's not like the flu. The flu can be terrible for some people, but I mean, measles is always going to be bad. Whooping cough is always going to be bad. The thing is, I think people are applying their perspectives on the flu vaccine to vaccines in general, which isn't the way to do things. They're also using the notion of autism in relation to vaccines. Now, I'll give you that autism is on the rise. But one of the reasons autism is on the rise is because our screening methods have improved. So we're finding it more regularly within the population just simply for the fact that we're able to diagnose it better. The other issue is we're having kids older. So a mother that is older is more likely to have a kid with autism. There are other factors. And what I can say is that they make up the vast majority of any differences that we've seen lately within the autism increase. The idea that letting your kid get whooping cough or measles for the very small chance that they may even be somewhat related to autism is a very difficult choice. Now, I couldn't find about 10% of the difference that is being created thus far. This peak increase in autism, there was about 10% that I thought could be missing, attributable to anything and possibly vaccines. The other thing which is interesting is that some research is being done in regards to how autism is actually the disease of autism, and some people are suggesting that it's related to the immune system. Now, there are certain additives that are used in vaccine cocktails that boost elements of the immune system, whether it's division of certain cells. Now, as a result, you could try and make that sort of correlation, but the reality is that the medical community needs to step up more and address these issues that these anti-vaccinations have logically and with open arms, and the anti-vaxxers need to open the ears up more and not think that there's this some sort of corrupt conspiracy to make you sterile or to give your kid autism. There are some odd goings on also with vaccines, which is something like if the vaccine kills you, that the government has set up a method that you can't sue that vaccine producer unless you file something of negligence. But if you are a very, very small percentage of people that die as a result of some issue with the vaccine, you can get $250,000 and that's it. And that's because the government has tried to make vaccines a very important part of health protocol or health services. And they don't want the manufacturers to feel like they can't make it because they feel like they're going to be sued for millions of dollars. So the government has done this as a sort of protection, but it also seems kind of sketchy. I'll admit. But again, we need to look at the whole encompassing issue and in order to get the best result, because right now kids are dying of whooping cough and measles that shouldn't have to be, and people are having misinterpretations of autism and misinterpretations of the effectiveness of certain vaccines. So this needs to be addressed, basically, and I hope this has helped you understand some of the contextual issues that are going on right now.